Hi, it's Jessica DeMassa with WTF.Health, and joining me right now, we have a good friend. It's John Lynn. Hi, John, the founder of Healthcare Scene and @TechGuy on Twitter.
Yeah, I'm excited to be here. We've tried to do this for so long, and finally here.
It's true. Finally, this is happening. It's not a dream. It's like I would like to pinch you, but I just don't want to hurt you. Okay, so I want to pick your brain. So you are somebody who, you've got a range of conferences and publications that cater to two different audiences in health tech, the CIO audience and also the health IT, health tech marketing crowd. So I want to pick your brain first on this CIO crowd because you're somebody who's been commenting on health tech, health technology, health IT for so long. The space has evolved. What do you see that's going on from the CIO perspective as far as like their interest level in digital health and all things health IT?
So I think most CIOs are faced with a real challenge when it comes to digital health. And I think the biggest challenge they have is that they're so overwhelmed with the operational minutia that they're dealing with. And I include in that operational minutia the EHR implementation that they just spent hundreds of millions or billions of dollars on, that it's hard for them to spend any sort of brain power or time on anything other than those things. So I think, one thing that's interesting being at a conference like Health is you see these amazing things that are really pushing the edge of what's possible. And the CIOs look at it and say, wow, that would be awesome. But I have 1,000 Windows desktops that I need to replace or I need to upgrade from Windows 7 because it's going to be sunset and that's going to be a HIPAA violation. And so there's this like tug and pull for a CIO to say, okay, well, I've got to deal with the operational stuff and I need to get value out of my EHR because my board just invested so much money in it. But I would love and I would have so much fun working on the digital health stuff. So I think we see that, kind of balance for them. And so what we see is that the CIO isn't dealing with it. They're usually pushing it to someone like a chief innovation officer or even the CMO or CMIO to go and do the innovation. So there's an interesting balance between the two.
Yeah, because where it falls apart usually is integration, more or less, right?
Yeah, I mean, if you don't have the data from it, then forget about it, right? So, and we've seen that with almost every person here. The question is, okay, this is great that you're doing something really innovative. Now, how are you going to get it to the EHR? And if they don't know an answer to that question, then I'm like, well, you're in trouble because guess what? The doctor's not going to go to your separate app to do something. You must be integrated with the EHR. Thankfully, it's possible now to integrate with the EHR. And there's even companies like Redox that are doing amazing things to do the integration. Or you can go straight to the EHR and they finally have APIs, at least most of them, to be able to do the integration.
I mean, we just even saw Uber go to Cerner and get added to their platform so that they can be something that's ordered straight out of the EHR. And that's a tech company, like a traditional tech company. So yeah, I think you're right about that. I have to go through that EHR.
Yeah, and I mean, so there's two ways they want to integrate too. One is getting data from the EHR to inform whatever they're doing, whether it's an analytics vendor or even Uber, right? Like they want to know who should I actually prompt to give a free ride to. And then the other one is writing back. Turns out getting the information from the EHR is possible for most systems, but writing back, we're still working on that.
Okay. How long do you think it's going to be before we figure that out? Because I mean, everybody's been talking about EHR implementation for a long time. And it's like people are burnt out on using the EHR, and there's things that are trying to disrupt the EHR, and then it's like we're going to be in this different alternate universe. But it's like, how do you see this playing out? I mean, you talk to these CIOs, and you really do have your ear to the ground and an understanding of a lot of their concerns, as I'm sure everybody watching just heard you beautifully articulate. So, what do you think? I mean, how do we get past this?
Well, I think that it really required a mindset change from the EHR vendors, and some are still going through that mindset change, because the EHR is not going to do everything. And whenever I say that, they're like, oh, I don't know, they are trying to, right? and the CIOs are kind of like, yeah, I kind of want them to because I want one neck to wring when there's a problem. But the reality is with genomics, with a lot of the stuff that's happening here, they're not going to build a full transportation system, most of them, right. Especially a rural health system. I mean, some of the larger ones did, and they saw how expensive it was, right? So, Uber is a great option, or Lyft is here as well, right? Both are great options to consider instead of building your own fleet. So it's like all of these things are going to be done, even genomics, forget about it. Like the health system's not going to do it themselves. So the EHR vendor needs to embrace the idea that they are the database of healthcare, where, yeah, the doctor is going to go to that interface and a lot of the data is going to be stored there. The EHR is going to be responsible for the billing and the compliance. which is what they're good at. That's what they were designed for. But then all of the other stuff that actually lowers costs, that actually improves the patient experience, is going to be done by someone else.
So how do those companies that do that's something else, like, improving the patient experience, or, helping make healthcare more accessible, bringing it to phones instead of the doctor's office, how do they work with the CIO? When you talk to these guys, like, what do they want? I mean, like you said, that a lot of times they're so busy, doing other mundane things, it's like they can't deal with the innovation. But how do we bring them into the fold? Because really, that's oftentimes where the conversation stops, is with the CIO then, who's like, can't implement this. Right. So how do we get them involved faster? If you're giving advice to the startups that might be out there, what would you say?
Well, and it's funny because that hits our healthcare marketing community, right?
Oh, good. Tell me.
We talk about that all the time, right? Because as a marketer, how do you market to healthcare? And it's really challenging because there's no single decision maker. There's no impulse buy in healthcare. I don't just go out and say, oh, you know what? I think I'm going to buy some Uber today, right? It's not like a t-shirt or makeup that you're like, oh yeah, I think I'm just going to buy it. And, on the moment, no, there's committees and everyone's involved. It's group decision making. And so if you want to do it, you don't just need to get the CIO involved. In fact, the CIO usually is not the one to push an initiative forward. They can hijack any initiative. If they haven't heard of that company, if they're not familiar with them, if they don't see you as a reputable company, then they can hijack it and ruin any sort of sales process. So they're an important influencer. But usually the discovery is done by someone below that, whether it's the CMIO, the CNO, someone that's using the system and says, hey, we have a real problem and I found a solution, and they bring it to them. And then they bring it to the CIO, often maybe with some peers, and then they say to the CIO, hey, let's evaluate a solution like this. And if the CIO has never heard about it, they'll say, forget about it, you're done and you're dead in the water, right? But if the CIO has heard about it and you have, an advocate within the organization that says, I've heard good things about this, then you have some progress. So really you have to get the full team involved, or any one of them can hijack the process.
What are some of the things that you're hearing from the marketers in this side of the world? What are some of their, some of their challenges that they're trying to overcome these days, and what are some of the opportunities that they see? I mean, things are becoming much more consumer friendly. That's got to be a good opportunity for them, right?
That's an interesting question. I'm not sure if the consumer friendly impacts them, because it's still an enterprise buy for almost all of these healthcare organizations. So the real challenges they face is, how do they shorten the sales cycle? And, I don't know if we have any really good solutions for that, but we're seeing some. I mean, I think through some partners you can do it. We see a lot of people doing successful things with partners. And so much of their marketing is through partners that already have a channel with an organization. So I think that's one way they're doing it. I think the other biggest problem that most healthcare marketers have is that every company is saying everything, and that they can do everything, right? So, every company is an AI-driven analytics vendor that's voice-enabled, that allows you to do whatever, right?
We got the right care at the right time to the right patient
Exactly.
In the right place, always.
So when your competitors are saying everything, whether they do it or not, right? And whether, I think the whole word AI has been totally corrupted and includes everything from a spreadsheet that does groupings all the way through autonomous pharmacy with robotics, right? And it means everything in between. It basically means nothing. And so being able to differentiate when you truly are doing something unique, whereas your competitor is saying they're doing something, the same thing, that's the challenge. And so at the end of the day, you usually break through that by taking a customer who's actually doing it and showing the results. And once you do that, everyone's like, oh, wait, Mayo Clinic did that and you saw these results. Oh yeah, maybe I should look into this. Or even more importantly, you really need a large health system like a Mayo Clinic, or large reputable. You need a mid-sized one, and you need a rural one. Once you have that trifecta, then you go to them and you say, oh, here's a case study of someone like you. And they're like, oh, so I could work with you. And then you have potential for a sell.
I think that's really smart, because I think that what you're describing, it's like all of these folks that are inside these healthcare systems, they have such different priorities and such different challenges. And then for the startup to come in and just be like, hi, plug this in, it doesn't work like that. You really have to understand their systems.
Yeah, and that's why, that first sell is so hard.
Yeah.
Because you're fighting an uphill battle, and it takes relationships, and it takes a lot of work. And like I say, beg, borrow, and steal to get that first client that you can then use to be able to sell to other people, because without that, you don't have credibility.
So speaking of credibility, I want to ask your opinion, from both vantage points. When it comes down to the big health tech companies coming into the space. Those names have a huge amount of trust that come with them in a lot of cases. So I mean, like, people trust that it's going to work. They trust that it's going to be advanced. The tech is going to be good. They may not trust the privacy part of things. They may not trust certain aspects of it. So I mean, what are you hearing from the CIOs or even the marketing folks about the big tech companies coming in? Is there excitement around that? Are people looking at Apple like, yes, this is going to be the thing that fixes it? Or are they looking at this with the same kind of skepticism that they're looking at these digital health companies with?
Yeah, what's interesting, I think Apple's actually the least of the biggest companies that in the healthcare space and really doing innovative things. I think Amazon, Microsoft, and Google are they're doing it, and there's multiple parts. One is the land grab for cloud. That is happening in massive way, and they're all spending as much money as they can to see who's going to own the cloud. And I think they're all three going to be winners. It's just how big of a winner they're each going to be.
But Apple has their own EHR.
Oh my goodness. if I hear another person tell me, like, if Apple built their own EHR, it would be great. I'm like, you're so full of crap. But no, they have a PHR kind of. And of course it's accessible to some data, but not even all of it. Okay. So it's like, what's the value of that? Right. But anyway, so.
No, it's the big tech companies. Tell me what the beat is.
I mean, what's interesting about them, I think is more like opening their own clinics like Amazon did is super interesting, right? Or even the Walmart's opening their own clinics. The consumer one, those ones are more of a disruptor, I think, than it is even the Microsoft or Google, which are actually providing technologies that could make them more efficient and be good partners for them. So I think that those are the kind of those two plays. Like, are they an infrastructure and service, that every health system's going to need? Well, that's really exciting. We may ask the question, is that going to lower any costs? Is that going to improve healthcare? I'm not so sure, right? But it's exciting for a CIO that maybe needs more reliability and more efficiency and all those things, right? Which are valuable and could provide some incremental benefit to healthcare. But it's not going to transform it the way. If you look at the other side, the consumer side, and kind of the consumer-driven healthcare with Walgreens opening clinics and Amazon, imagine them opening a clinic at all of Whole Foods, right? I mean, it's not hard to see how that would be possible, that they could do that. And so it's like, if they do that, will that transform healthcare? I'm not sure it will. Yeah. And this is why. I think they're going to chop off this commodity service, all of this low-level commodity service, and it's going to leave all of this challenging, complex conditions to primary care, to specialists. And what does that mean for them? If you just chopped out all the commodity from all these doctors, they're going to be overworked and underpaid. Like, I don't know. It could be a recipe for disaster, in my opinion.
John, let's hope not. I mean, no, but I think that's a realistic view of things, and I think people are looking at that as those services will be able to take. And sometimes the flip of it is you hear, well, to take the burden of that stuff out of the system, so that the clinicians and the hospitals can be there for the things that are more critical, that are much more complex.
Well, and that's fine if we change our reimbursement system to pay them for the more complex, right?
Right.
But what's the chance of reimbursement changing? That's the challenge. I mean, it's so complex though.
Absolutely. So for those who want to hear more from you, go ahead, promote your conferences for us. Come on. So tell everybody what are they and where to find out about them.
Sure. So I mean, I think the best place is go to healthcareittoday.com. That's our media site where we've published 13,000 articles. We have a podcast that we put out every 2 weeks. So,
fantastic content, by the way.
Thank you. It's fun, I mean, we love this stuff. In fact, that's our tagline for our podcast, was we love this stuff, which I just said naturally because it's true. But beyond that, we have our healthcare marketing community, which is hitmc.com or hitmic.com. And you can find all the information about healthcare marketing there. And then we also have our Health IT conference at Expo.Health.
Awesome. John, thank you so much. This interview was so worth the wait. It happened. I know. I can't believe it. Oh my God. People on Twitter are crying right now. Like, I never thought it was going to happen. I never thought it was going to happen.
Viral video
oh my God. Let's hope so. Here it is right now. John, thanks so much. It's a pleasure. Totally worth the wait, like I said. Hopefully you feel the same. You can tell me after. All right. I'm Jessica DeMassa with WTF Health. Thanks for joining us.